Today we are going to review wound care. Oxford Dictionary defines wound care as an injury to living tissue caused by a cut, blow, or other impact. Mind you, these wounds could be open wounds, skin disease, frostbite, trench foot, and burns. There is 8 different main types of wounds. Skin disease and ailments, including boils, fungal infections, and rashes. All these can develop into serious health problems and cause you discomfort, and you should treat them. Boils is another one. In order to treat boils, you need to apply a warm compress to bring the boil to a head. Then open the boil with a sterile knife, needle, or similar sharp item. Drain out the boil, then using soap and water, just clean it out. Cover the boil site and then check it periodically to make sure no infection develops. And I will go over infection care later on in this video. Fungal infections. You need to make sure to keep the skin clean and dry and exposed to as much sunlight as possible. Like insect bites, don't scratch the affected area. During the Korea conflict, soldiers would use antifungal powder, chlorine, bleach, alcohol, vinegar, salt water, and iodine to treat their fungal infections, like athlete's foot and such. To mind you, they had varying degrees of success. Like with any unorthodox method of treatment, used with caution. Skin rashes. Now, to treat a skin rash effectively, first you have to do is determine why is the rash there. This can be difficult even in current medical situations. But it's important to remember when treating a rash, you have 3 rules. First, don't scratch it. Second, if it's moist, keep it dry. Third, if it's dry, keep it moist. Remember to treat your rash like an open wound. You need to clean and dress them daily. There is different things you can find in the wild to use as antiseptics to treat your rash. Iodine tablets, use 4 to 15 in a liter of water, produce a good rinse for the wound during healing. Garlic oil, rub it on a wound or boil it down to extract the oils out of the actual garlic. Then use the water that you got the garlic oil from to rinse the affected area. Salt water. Use 2 to 3 tablespoons per liter of water to kill bacteria. Bee honey. Now, when I say bee honey, I mean natural, wild honey, not the overprocessed stuff you can get at a store. Use bee honey. You can use it straight or dissolve it in some water. Frostbite. This is an injury from frozen tissues. It can affect the feet, hands, or exposed facial areas. Deep frostbite extends below the skin and the tissues become solid and immovable. Don't try to thaw the affected area out by placing them near a fire. Rather, gently rub them within lukewarm water, dry the area, then place it next to your skin to warm it at body temperature. In cooler weather, not frozen but just cooler, a problem that can develop is called trench foot. It happens when your feet or other body areas are exposed to wet or damp conditions at a temperature just above freezing. The nerves and muscle can sustain damage and gangrene can occur. In extreme cases, the flesh dies and it's necessary to have the foot or leg amputated. The best prevention is to keep your feet dry, carry extra socks and a waterproof bag in your bob. Also, wash your feet daily and put on the dry socks. Burns. When you get a burn from a fire or some other hot object, you need to make sure that first you cool the skin with some ice or cool water. Make sure you apply cool dressings or just rags over the burn, and then treat it like an open wound, which I will cover in the next section. You need to make sure that you drink plenty of water to replace the fluids you've lost and to help heal the burn. Also, if available, consider morphine unless the burns are near the face. Open wounds are very serious in survival situations due to the possibility of tissue damage, blood loss, and infection. Bacteria can be on the skin, clothing, or even dirt, and that can cause a serious infection. In order to reduce contamination and promote health, you need to get the wound clean as soon as possible by doing the following. Clean the wound, look for an exit wound if it was a gunshot or other projectile that caused the wound. Clean the skin around the wound because you can harbor bacteria around it on your skin, and then rinse, don't scrub, the wound with large amounts of water under some pressure. If water is not available, that sounds disgusting, but you can use fresh urine as an alternative.